Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. As always, we're joined by Dr. Robert Popovian, tuning in from Washington, D.C. He's a pharmacist, he's an economist, and he's the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Connor Mertens from Seattle, Washington, my co-host and our patient advocate and community outreach manager.
And we got a super duper special guest today, Robert. We'll be joined later in the episode by Zoe Rothblatt. Zoe is our Associate Director of Community Outreach at GHLF, who also happens to be my partner in crime on another podcast of ours, Breaking Down Biosimilars. And as an advocate and patient herself, she's going to be bringing the patient perspective to our conversation, which we know is super important. So we're excited to have Zoe on.
Absolutely. We're very glad that she can join us. And I think you actually just gave away our topic for today, Connor.
Spoiler.
Today we'll be talking about biosimilars. So Connor, let's get into the episode. What does the number 21 billion mean to you?
You and your numbers, Robert. 21 billion sounds like the budget I'm going to give myself for takeout this year.
Oh my God. We need to start talking managing costs here, Connor. But no. With all seriousness, according to Amgen's most recent Biosimilars Trend Report, biosimilars have saved the U.S. healthcare system roughly $21 billion over the past 6 years.
That was 21 billion with a B, right?
Absolutely, sir.
That's a lot of tie. That's a lot of takeout. And that's a perfect transition. I know that biosimilars are going to be front and center. We talk about them often at the Global Healthy Living Foundation. But why is 2023 a crucial year for the biosimilars?
Well, 2023 is when we're going to see the introduction of a biosimilar for Humira. So why is this important? Because Humira is the largest selling all-time biopharmaceutical in the world. It generates about $20 billion in sales annually in the US only. And this is going to be interesting to see because not only biosimilars are going to be introduced in 2023, but there's going to be multiple biosimilars of Humira introduced this year. So that is why it's a crucial year to look at what is the impact of introducing competition to the marketplace. Are we going to see lower prices? Are we going to see lower costs for patients? Those are all the questions that we're going to have to face in the next 12 months.
And I think that, two questions that kind of go hand in hand are what have we learned from biosimilars so far when they've been introduced into the market? And more importantly, how do they compare to their biologic versions?
So let's talk about the market first, and then we can talk about the actual safety, efficacy, purity of these medicines. So from a marketplace, the data is very clear. Every time a biosimilar has been introduced into the market, the prices of the originator biosimilar drops. But not only the price of the originator biosimilar gets reduced, but also the competitors, the biosimilars themselves. And the reason we know this is because in the last 6 years, when biosimilars have been introduced, most of them have been physician-administered drugs. And we do have transparency in the net prices of these medicines. These medicine prices are published by CMS, and they're called average sales prices, which is the net price, or as close to the net price that you can get in this marketplace. And what we've seen that every time a biosimilar gets introduced, the net prices of these medicines get dropped. Employers, government, patients end up paying less for these medicines. So competition definitely has worked. It reduces prices, and it creates savings for the health system, for the patients, for the employers, for the government, and most importantly, it improves access for all of our patients.
Well, and the other thing about these biosimilars is, as you can find out on our other show, Breaking Down Biosimilars, that they work the same. These drugs are, in all essence, essentially the same drugs. They're the efficacy, the safety, and more importantly, we've seen the success of these biosimilars across other marketplaces in Europe and in Canada. And then we've seen how successful and more accessible it's made these drugs. So how will patients in the U.S. benefit from these Humira biosimilar introductions to our marketplace?
So that's the million-dollar question that's to be determined.
The $21 billion question?
Yeah, that's a very good point. So the reason for that is because unlike the physician-administered or provider-administered biosimilars, the Humira biosimilar is a self-administered drug, and it's provided through the pharmacy benefit. The pharmacy benefit, unlike the provider-administered drugs, doesn't function under average sales price, which is the net price that we discussed. And remember, a patient's coinsurance and deductible is always based on the physician-administered drugs based on average sales price. So they do benefit from all of the rebates and concessions. On the other hand, the patient-administered medicines, which are governed through the pharmacy benefit, those negotiations, those rebates, those concessions never end up in the hands of the patients. They're absorbed as profits by the pharmacy benefit management companies or PBMs. And in the pharmacy benefit side or the self-administered drug side, patients end up paying their coinsurance and deductible based on the average wholesale price, or better said, the retail price of these medicines. So my guess is, and a lot of policymakers have said the same thing, and economists, that you will not see a drop in the average wholesale price of the Humira, nor a significant difference in the biosimilars when they're introduced in the marketplace. However, there will be fierce competition on the back end with regards to rebate contracting, where significant rebates and concessions and fees are going to be passed on to the PBMs and insurers for the coverage of these medicines, both the Humira and the biosimilars. However, because of the way benefit design is set up on the pharmacy benefit side, patients are not going to see those savings, and they're not going to basically benefit from any of the concessions, the increased concessions, rebates, fees, everything else that is provided by the biopharmaceutical company to the PBMs and to the insurers.
So, Robert, as you mentioned, once the PBMs get involved, there starts to be a need to kind of look a little deeper about where's the money going, where's the money coming from. So I'm wondering, if the patient won't benefit directly, then who's going to benefit from the biosimilar introductions into the market?
So who will benefit is the PBM and the PBM's bottom line and the PBM shareholders, and it will be captured as profit by these insurers and the PBMs. Now, the assumption is that some of that may, and I have to underline that may and capitalize it, be passed back on to the employers or to the government at some form of premium support. But that's an unknown because we don't have transparency on the pharmacy benefit management side regarding the pharmacy benefit design, unlike the transparency that currently exists in the physician-administered medicines. So we know there will be savings, there will be significant savings, there will be fierce competition. These biopharmaceutical companies are going to give a lot of rebates and fees and concessions to be able to get coverage from these PBMs on their formularies. But unfortunately, because of the opacity of the way contracting is done on the pharmacy benefit side, we're never going to know what those numbers are, and we're never going to know how much of it is captured as profit by the PBMs and how much of it may at some point be passed back on to the employers or to the government as premium support. We certainly know, and this is very important for our patients, that none of it is going to be passed back on to the patient at the point of sale.
Now, it's 2023. I hear a lot of mays and maybes and potentiallys. How long until we can see meaningful reduction in the list price of these drugs?
So it depends. It depends on how much are these biosimilar companies willing to drop their price, their average wholesale price or their retail price, and how much is the policy community, the economists, patient advocacy group, the provider groups, and also the media are willing to put public pressure on the PBMs and insurers to do the right thing and cover the lowest listed price or the drug that has the lowest list price instead of covering the one that has a very high list price but provides the PBMs rebates and concessions to be covered. So again, we may see it. I'm hoping that we will see it, that some biopharmaceutical company that is developing biosimilars is brave enough to come out and slash its average wholesale price or retail price significantly and draw attention from policymakers and patient advocacy groups and patients and providers, and for us to put pressure on the PBMs to do the right thing. I'm just extremely skeptical at this time.
I think it's a good time for us to bring in a patient perspective. We're getting a little in the weeds here, but I'm curious how this will impact everyday patient. So with that, it's time for our special guest, Zoe Rothblatt, tuning in from Nashville, Tennessee. You already know she's an expert. She's an advocate. She's somebody that uses biologics and the co-host of another great podcast you might have heard of called Breaking Down Biosimilars. Thanks for joining us, Zoe.
Hi, Connor. Hi, Robert. Thank you so much for having me on. I've enjoyed listening to your conversation so far. And I mean, I'm just like cracking up in the background. You make a topic like biosimilars so fun and with so much levity. So I'm really excited to be here with you both. So, yeah, hi, listeners of Healthcare Matters. I'm Zoe Rothblatt. And like you heard, I co host Breaking Down Biosimilars with Connor. I live with spondyloarthritis and Crohn's disease. So I've been on biologics for about 5 years now. So yeah, I mean, I'm really interested in biosimilars since learning more about them, and especially personally as someone who might end up being switched on one. So I'd love to share with you guys my thoughts as a patient, unless you have some specific questions for me.
Oh, I totally do. And you actually kind of set me up perfectly. You said you might be switched to one of these biologics. My question is, will patients be switched without their knowledge? Because that's, when we talk about collaborative care, that has to be an important conversation with your doctor, right?
Exactly. It's so important to have conversations with your doctor and be on the same page. And that's just one level of it. And then with something like medications, you guys were mentioning all the stakeholders before. Oftentimes, insurance, PBMs, these other groups are coming in and they're part of that process. So the communication that you have with your doctor can get interfered sometimes. You just mentioned step therapy. That's an example of when someone else interferes. So the question of whether patients will be switched without knowledge is a little bit nuanced. I'm sure Robert can touch on this, but there's this concept of interchangeability. And I believe one of the biosimilars coming out this year for Humira has interchangeable status. So what this means is it's similar in the generic sense for pills where, your doctor prescribes, let's say, an antibiotic, and then you go to the pharmacy and you pick it up and you get a generic version. That would be an interchangeable in the case of biosimilars, where they do a similar thing and a biosimilar is replaced for your biologic. Otherwise, you would see this information. So it's always great as an advocate to double check what your prescription says, but it could be a little surprising, which is scary. But otherwise, your provider will likely be notified, and you may not have much say in the matter, unfortunately, but you'll definitely be able to have conversations with your doctor. Robert, did I get that right?
You absolutely got it beautifully. And Zoe, one thing is that the good part is if you are substituted for a biosimilar and you are currently on a brand name drug, by law, pharmacists are required to inform you upfront about the substitution. And this is similar to the laws that we have regarding generics. So as a pharmacist, even if I substitute you from a brand name to a generic drug, a small molecule, I am legally obligated to let you know prior to the substitution. Because there is no such a thing as an auto substitution. This is something that everybody gets wrong. Only a few health plans and few Medicaid programs have mandatory substitution. Majority of time, your benefit design is what dictates whether or not a pharmacist may substitute. But that's also a may. You could still acquire the brand name drug, but the differential in out-of-pocket costs is so significant, as you know, with small molecules, with generics and brand name drugs, that most patients choose to go with the generic. And in this case, you will be informed as a patient by the pharmacist if you are switched to the biosimilar. And also, it's important to note that whether or not it has an interchangeable designation or not, the pharmacist still has to inform your provider at some point that you have been substituted. The only difference between interchangeable biosimilar and non-interchangeable biosimilar is that the pharmacist does not have to get the authorization up front from the provider if it's interchangeable. If it doesn't have that interchangeability designation, all they do is basically call the provider to get the authorization up front. So that's the only difference. But the safety and efficacy and purity of all these drugs is exemplary. The FDA has approved these medicines. As Ben, our producer, knows, having lived in France for many years, these biosimilars have been available for Humira for almost a decade. So we have a lot of safety data regarding these medicines. So as a patient, I would just follow the direction and the best thing you said, which is talk to your provider, both your pharmacist and your physician, to make sure they're doing the right thing for you.
Yeah, I totally agree. Knowledge is so much power when you live with a chronic condition that often, your disease, it feels like it's controlling you. And I always feel like a way to take some of that power back is through knowledge and just learning more about my condition. And it's interesting with biosimilars because when I first heard of them, I had that uncomfortable feeling that many patients have where it's like my number one priority is feeling good. And that's how I feel on the drug that I am now. I've been on it, this one, the Humira, for a year now, and I feel good. And, it's nerve-wracking to say I'm going to switch my plan and maybe not have the same results. And I guess I first learned about biosimilars a few years ago, and slowly but surely after learning more about them, that like initial hesitation and yucky feeling has gone away because, like you said, the FDA has approved these drugs. There's rigorous testing on efficacy and safety. They've been around in other countries for a long time. And if you asked me a few years ago if I would be comfortable switching, I probably would have said maybe not. And now I would say, yeah, I'll try it. I've learned a lot about it and I've taken some of that power back from the unknown and had conversations. Actually, when Connor and I started the podcast, I brought it up to my doctor and her face lit up because she said not many patients ask about biosimilars. And I just think it's so important to proactively be having conversations with your doctor, whether it's about biosimilars or other medications or other different tests, just so you're equipped with knowledge before the time comes. And if it does happen, you feel a little bit better and it's not like the rug's being pulled out from under you.
So, as a healthcare professional, I will tell you knowledge is power and never give up the knowledge and be brave enough to ask the question from your providers. They are there to help you. And if they're not answering your questions and not helping you through this journey, it is time for a new provider, unfortunately.
100%, especially because a chronic condition is chronic, right? You're going to live with it. It's lifelong probably. So you need a partner in care because, you can't just be settling for suboptimal care, be annoyed every time you go see your doctor because this is your everyday well-being. And I heard you guys both talking about cost a lot in the beginning, and I think that it's not so clear how biosimilars will affect costs for patients. But I do know I've heard from patients that a big concern is, will biosimilars have the same type of support programs that biologics do? And from what I've seen from biosimilars so far is that they do, but it's definitely important to, one, talk to your doctor about what supports are out there, but two, when you Google your drug name, you can often find different support programs, and it seems like biosimilars are getting the same kinds of programs that biologics do, which is really comforting as a patient. I use it for, copay support when I was learning how to do injections. They had amazing injection training videos. The injection pen for biosimilars might look different than biologics. It might take you a little bit of time to get comfortable with that injection, and it feels like the supports are there, which is really important to patients.
Zoe, my friend, thank you so much for joining us. Your perspective is absolutely brilliant. You brought so much life to this conversation, and we're lucky to have you, and you're welcome back anytime.
Thank you both for having me on. This was a lot of fun, and thank you for talking about such an important topic that's really relevant right now to patients. And I hope people listen to this and feel more confident in their healthcare decisions and treatment decisions going forward. And also, Connor, what do you think I should say next?
I think this is a great opportunity to plug a podcast I've heard of once or twice.
You read my mind. Everyone check out Breaking Down Biosimilars for all you need to know about biosimilars and the kinds of decisions and questions that go into them, their approval process, and so much more. Thanks, guys.
Well, I learned a lot in that short amount of time. Zoe is absolutely brilliant. But really, I'm just excited that biosimilars are finally being introduced into the market in the US. And while there are a lot of question marks, I think that this is a big positive step, and we're going to see a positive impact on patients. And like you've said, the competition will only help create more opportunities for patients to have access. But let's make sure you get that last word. What do you think, Robert?
So thank you, Zoe, for joining us, first of all. Number two, Connor, you're absolutely right. I think there will be significant competition in 2023 for Humira through the biosimilar introductions. Perhaps, maybe not, patients will save directly from all the concessions and everything else. We don't know that yet. I don't suppose they will. But one thing we do know is that whenever competition comes into the market, access improves for patients. So that is the silver lining that we have to hang on to, that competition will always improve access. And that's what we're all about. We want better access for our patients.
Well, Robert, thanks for breaking down biosimilars for us.
You're welcome.
And thank you again, Zoe, for joining us, and to you for tuning in. Don't forget to subscribe to our podcast on Apple, Spotify, or wherever you might be listening so you never miss an episode. You can also find our podcasts on YouTube. We're literally everywhere. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
You can also send us an email or audio clip to healthcarematters@ghlf.org. And as always, you may be featured on one of our upcoming episodes, but please do send in your comments and questions because that will help us tailor our podcast based on your needs as patients.
As always, he's Dr. Robert Popovian.
I'm Zoe Rothblatt.
And he's Connor Mertens, and we'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.